Good morning and welcome to Radio Friends on Tuesday, April 30th. We're just about out of the month of April. We're going to talk about May, which is Stroke Awareness Month. And I want to introduce you to Dr. Camilo Gomez from University Healthcare. Good to have you here, Doctor.
It's happy to be here.
May is Stroke Awareness Month, so you wanted to talk about warning signs of stroke and what you can do to help prevent strokes, right?
That is correct.
Warning signs.
The warning signs of stroke are a sudden onset of weakness in one part of the body, or numbness in one part of the body, or visual abnormalities, or difficulties with language, or unusual headaches, or even certain sudden dizziness that is unexplained. The key is the suddenness of new neurologic symptoms that have never been present before and that cause a change that is appreciable by the patient.
Okay, if it happens very suddenly, you shouldn't take a chance. You should call 911 at that point?
That is correct. That is the one thing that we recommend and have been recommended for as long as I've been in this for 40 years is dial 911. You should not be necessarily chasing your doctor. You should not be certainly negotiating with your neighbor as to see what they know about this.
Just call 911.
Just call 911.
So err on the side of safety.
Absolutely, because minutes do matter. The quicker we can get to you, the quicker you can get to us, the more we can do for you, and the more tools we have available at our disposal to manage the emergency.
What are some of the things that you can do to help prevent stroke?
Dealing with the risk factors. That's something that anyone can do with their primary physician, controlling high blood pressure, controlling diabetes, controlling cholesterol, and those patients who have atrial fibrillation, they need blood thinners. And really recognizing the fact that many strokes have warning signs that alert us that something is wrong, and then coming to a specialist like we have at our Comprehensive Stroke Center at University of Missouri, where we can evaluate patients and decide what is the best strategy to prevent stroke.
Can you have a stroke and not even know it?
That is correct. That is possible. In fact, for every stroke that we see clinically when we examine those patients, many times, depending upon the underlying risk factors, we find several that they are not even aware that they've had. Very small ones, or in parts of the brain where the patient's symptoms make them unaware that they actually have had a problem.
So if you had a stroke, you didn't know it, your chances of having a major stroke are greater. Is that right?
Stroke in and of itself is a risk factor for additional strokes, and particularly in certain conditions such as atrial fibrillation or blockages of the carotid or the vertebral arteries. When patients have minimal or small strokes, it places them at risk of having actually a major problem.
Obviously, there's so much more to talk about, and we're out of time. But if people want more information, the best thing to do would go to the MU website, which is muhealth.org/minutes matter, right?
That is correct.
And minutes do matter. They can mean the difference between life and death.
That is correct. Time is brain.
Thank you very much, Doctor.
Thank you.